Hey everybody, it's Dr. Levitt here, and I'm at my office where earlier today I saw a young man whose case I think illustrates a really important point that I want to share with you today. This man was about 31 years old, and he came in to me with several months duration of severe pain in the left shoulder. This pain had been diagnosed as a rotator cuff tendonitis, and he had been treated with conventional orthopedics using anti-inflammatory medications as well as a series of corticosteroid injections into the shoulder joint itself. And he was still in quite a lot of pain. So he came in to see me for an additional opinion on this situation, and throughout the course of our treatment and the diagnostic process, it became clear that not only did he have a rotator cuff tendonitis, but his shoulder, the entire shoulder complex, was really pulled in. He was really guarded and cautious with the movement of the shoulder, and there was all sorts of tension in the upper part of his back, in the lower neck, and in the muscles of the rotator cuff that support and help to mobilize the shoulder itself. So the treatment plan consisted of putting him on my table right here behind me and doing some body work, some manipulative work, soft tissue therapy, trigger point release work, as well as some bony manipulations, kind of like what a chiropractor might do. And the treatment looked almost miraculous, right? So in a short span of time, just 10 to 15 minutes worth of body work, this man's arm was significantly less pain and much improved range of motion. In fact, he looked at me with kind of wild eyes, like, how did you do that? It sort of looked like I treated rotator cuff tendonitis without any anti-inflammatories. And that's the point that this case illustrates, is that this young man indeed had rotator cuff tendonitis. The tendons of the rotator cuff musculature were inflamed. They had been pinched and they were inflamed and they were no doubt irritating. But his pain was not exclusively caused by that rotator cuff inflammation. It was also caused by the fact that his shoulder was pulled in and that his posture and his biomechanics, the movement of the shoulder, was all misaligned as a result of him trying to protect himself from this pain. Let me share with you a metaphor that I use in this situation a lot. If the right front tire of your car is worn out, is sort of balding in an abnormal pattern, and you take it to a tire shop and they tell you that your car has a tire problem and the tire needs to be replaced, this is true, right? The tire does need to be replaced. But the reason why the tire is worn out is because the alignment of the car is off, right? The axle is bent or shifted or something. And without fixing that problem, the new tire will continue to wear out in that same pattern. So this example of the car tire analogy is exactly what was occurring to this shoulder. This young man had some rotator cuff tendonitis, probably as a result of repetitive motion in the work that he does, and then his alignment went off. His axle got bent because he was pulling and holding his shoulder in. So any movement with that bent axle, with that abnormal biomechanics, was exacerbating the tendonitis and sort of squeezing and pinching that already irritated tendon. So when we corrected the alignment using some musculoskeletal techniques and body work, his shoulder movement was liberated and his shoulder pain was reduced dramatically. So it's a really important lesson to think about. Just because you have tendonitis or bursitis or any other itis doesn't always mean that that itis is the cause of your pain. Think about that lesson in the story of the balding right front tire the next time that you have any orthopedic injuries, and I hope that helps you. So take good care.